Hello, everyone. This is Katrina Saucier with Sustainability Dashboards, and I would like to thank you for joining our deal learning session, which is about preparing for the COVID-19 virus, which has been at the top of all of our minds. Presenting today, we have Steve Ashkin, and I just want to thank you for joining us and also just mention that your audio is on mute, but we would like to make sure that that does not impede your participation. So we will jump right into that. Next slide, please. So first, we just have some quick housekeeping stuff to make sure that you are able to ask questions. It's very important, as well as a quick update. As most of you can see, this session has been brought to you by the DEAL program. And the DEAL program is a specialized sustainability and efficiency program that we have for distributors. But given this was such a timely and important subject, we really opened it up to other distributors as well as industries that are dealing with this on the front line. So we'll also be doing some quick updates, little DEAL housekeeping, since we'll be speaking with you all. Jump right into the learning session. We'll be spending the bulk of our time, and then question and answers. Next slide. So in terms of housekeeping, we really want to make sure you can ask questions. So I have a couple screenshots here of what your screen may look like. First, I want to make sure that you're able to reduce the videos that you can't actually see because we've disabled them. So you can actually grab that 3-line section where you see the vertical red arrow to move that up so your screen can fully take up the desktop, as well as you'll see where the red arrows are that are pointing to a chat icon. And so if you click on that, you can chat your questions. Please be sure to do that throughout the presentation, especially if you have a question pertaining to the materials that Steve will be discussing, mainly because I will be asking topic-specific questions through the presentation. And we will also close with some Q&A at the end to ensure that we answer all the questions that we do have. Next slide. So one thing I do just want to emphasize, given this is our DEAL learning session, is that as part of the DEAL program, our DEAL participants, those of you who are on the call, have been working really hard to improve your efficiency, reduce operating costs. And I really just wanted to congratulate all of you for our collective achievements that we've had over the last 6 years, 4 years, I believe, where we have actually avoided spending or saved about $1.5 million collectively. While doing that, this group has also reduced their carbon footprint by 10%. I've also been having the pleasure of speaking with most of you and performing your annual assessment, where we're really diving into your performance and seeing how you're performing. And on average, we're seeing about an avoided cost about $20,000, which is really great to see, particularly given that it's about a six times ROI. So it's really great to see all of you improving your performance. And I know this is a very serious subject that we had to talk about, but I thought I wanted to bring some good news into the conversation as well. So great work, everybody. Keep up the hard work. And now let's get down to business. As we mentioned, I think we can all agree that these are unprecedented times. The reality is that our lives have kind of become a controlled chaos, both professionally and personally. And that means working out of a home office while you have school-age kids making noise in the background. So if you do hear any noise in the background, I'm one of those people. But really, our goal today is to help you unscramble all of that noise and to take away some key points. Because honestly, I consider you, the cleaning product distributors, part of this front line. The fact of the matter is that you are the ones supplying and managing the supply of crucial high demand products. that are making it possible for our healthcare workers and first responders to do their job. So honestly, one reassuring fact that I have is that knowing that you, part of our team, are in this solution and helping, being that voice of reason. So it's really our honor and pleasure to speak with all of you today and to share some of this crucial information during these times. So without further ado, I would like to introduce Steve Ashkin. Most of you already know him, so he probably doesn't need much of an introduction. You all know his credentials and his past work, but on a personal note, I've been working with Steve for about 9 years now, and one simple thing I can say about him is that he's very passionate about these issues and genuinely cares about this industry, and will do what he can to improve it and make a difference. And it's really nice to have the opportunity that he can share this information with the group. So without further ado, Steve, please take it away and let's get into the details here.
Thank you very much, Katrina. And my thanks to all of you for spending some time on the phone with us today. I know that your time is incredibly valuable. I'm sure you're busy. I'm sure you have a lot of things on your mind. So the number one thing that I want to remind you, as Katrina pointed out, is that you saw that little icon for the chat feature. Please submit some chats. Please submit your questions. We want to be absolutely as helpful to you as possible. I do have to say that over the last 30 years of my career, I have done hundreds of PowerPoint presentations, both live and via webinar. And this by far has been the most difficult one that I have ever done. And the real reason is because the information is literally changing on a daily basis. So what I wanted to do in this presentation is to think about how I can be most helpful to all of you. And so you see on our agenda, there's really two parts to this discussion. And the first part is I want to just talk about and help you really understand where you can find the information. You know, if we were going to go through everything that CDC and EPA and OSHA is telling us, as well as what local, state, and other health organizations are telling us, health departments are telling us, it's just a massive amount of information. So rather than trying to do what probably is a multi-day workshop, I really want to just walk you through the sites so you know with confidence where you're going to be able to find the answers to your question. And then the other part of it is, on a very personal level, I want to share with you some of the things that I think will be helpful as we start sending people to work from home, other situations. You know, those of you who are on the phone, you are leaders. Otherwise, you wouldn't even be here. So what I'm also wanting to share with you is some of the lessons that we've learned so that you can help guide and instruct others around you who really need some support and help. You know, it's not enough just to tell people prepare or tell people work from home. I think that they'll be much more successful both personally and professionally, especially for those who need a little bit of guidance. So that's the second part of the program, and then we'll jump into questions and answers. But before I begin, I want to also leave you with this overriding thought. I'm a big fan of author Stephen Covey, and you know, his famous adage is we should begin with the end in mind. And this is sort of my focus, the thing that I really want to emphasize, that the coronavirus, this issue will pass. It will, whether it's in a few months or whatever the time frame is, it will pass. And we need to also think about what happens when it's over. And I want to make sure that the world sees us as professionals, sees us as the people who really contributed to saving people's lives. I believe in our industry. I believe in you. We really can make a difference. And as part of all of this, I was on the call yesterday with a group of nurses who are putting together information for helping people clean at home. And I told the nurses from the bottom of my heart, thank you for the work you're doing. My thanks to the nurses, my thanks to the doctors, my thanks to all the first responders. They are literally putting their lives on the line. And then I reminded them, when they express their thanks and gratitude, show us some love, right? Show the cleaning industry, the environmental services people, the janitors, the custodians. Maybe they'll forget us, but I won't. And we have to remember how important we are. And at the end of the day, we want people to understand that that cleaning really is an important, effective, and low-cost health strategy. Let's change the way people think about our industry, and you are the leaders to help us do that. So let's just jump right into it. As I mentioned in the beginning, there is an enormous amount of information from CDC and others about how we should prepare. And one of the things that I'm encouraging everyone to do is to refer to the experts, to the CDC's website. And if you haven't already done this, please bookmark this page in your browser. And if you're not sure how to do that, at the far right corner of the top of the page for your browser, right, whether you're using Google Chrome or using Internet Explorer from Microsoft, Safari, whatever you're using, typically on the far top right-hand corner in the bar where you type in the information, there's a little star there. Click on that star and add this website, and you see it posted here, to your favorites. This is what the whole presentation is, and this is really what I'm recommending to everyone, whether you're from the cleaning industry, whether you're a facility manager, whether you're an educator. This is where we need to go for reliable information. And remember, while we're not doctors, but we really are professionals. And while we don't need to know everything, we just know where to find it. Let's talk like the experts because they're telling us what to say. So here's what the main page looks like. And if we would look at it, you see there's this, the page, if I could scroll down, you see resources for the community. And if I scroll down on that page, you would now see these 4 other boxes: travel, schools and child care, business and employers, community and faith-based organizations. So you go to the home page, scroll down, and let's take a quick look at what you're going to find under businesses and employers. If I clicked on that button, it gives you 2 options: the interim guidance for businesses and employers and cleaning and disinfection recommendations. This is where you're going to find the appropriate information both for your clients, right, the clients, the customers of the cleaning industry, as well as for your own business. So let's take a second and let's look at what is on those pages. So let's begin by looking at the interim guidance for business and employers. And on that page, you see 4 basic areas that they're addressing: strategies for employers to use right now. And if you are a business owner, if you are a senior official in your organization, I highly encourage you to look at that. You see planning considerations. It will give you some of the details that you need to follow, or at least to think about, so you can put together a plan for your organization. You see considerations for creating an infectious disease outbreak response plan, more resources. So this is where, again, where you're going to find that information. So let's dig into it a little bit. Again, just to give you confidence of what is there. I think that when I go through it and when I've gone through it with my clients, they've all found this to be extremely helpful and frankly take some of the stress away. The information is there. We will get through this. We can get through this. We know how to clean. We know how to disinfect. We know how to do this stuff. So strategies for employers to use right now. And they have these 6 major subsections in that area. So if you're wondering about how to encourage sick employees to stay home, there's a bunch of information on there. And please forgive me for not digging into every single one of these bullet points, but this entire presentation is in an hour with questions and answers. So again, you'll keep hearing me say, this is why you need to know where to go, because there is a lot of stuff here. So in any event, information on sick employees, staying at home when sick, perform routine environmental cleaning, advise employees before traveling to take steps, avoid measures in response to the occurring sporadic importation of the COVID-19 virus. Again, there's information on each one of these sections, but because this is a presentation primarily for the cleaning industry, let's dig into the routine environmental cleaning section just a little bit. So here's what it says when we expand that. And this information is lifted literally from their website. I didn't add any more examples. I didn't make any changes, although there's plenty of things that we really can talk about, and I will get into that just a little bit. But you see the recommendations are to routinely clean all frequently touched surfaces, and to give some examples. It directs us to use the cleaning agents that are usually used in these areas and follow the directions on the label. Again, we know what we're doing. The cleaning industry is actually well prepared to deal with this stuff. So routine cleaning of highly touched surfaces using the cleaning agents that we've always been using. Goes on to state no additional disinfection. Right? We're going to disinfect what we've routinely done, and it suggests that we provide disposable wipes. But I do want to share just a few things about that. You know, people ask me, well, what is routine cleaning? And let's face it, we should take the opportunity to really reconsider what we're doing at this point. Many of us clean based on an existing contract that we had that dictates frequencies and areas to be cleaned, etc. If you're in the cleaning industry, if you're a service provider, sit down with the facility manager and review what needs to be done and the frequencies. Remember, the buildings are changing. People, many buildings are closing down. Governments are at half staff. There's lots of different changes going on. So meet with the facility manager to understand best where people are so we can really focus the resources that we'll have on hand to really take care of them. So really reconsider the frequencies and really think about when we talk about touch points, let's make sure we really are paying attention to them. And my recommendation is really think about where people congregate, where people share things. So for example, in an office building, let's pay attention to break rooms. Let's pay attention to the areas where multiple people are going so that we can make sure we're paying attention, cleaning and disinfecting everything that lots of people touch. And go in if you need to, pay attention to it. If you go in a break room and you see there's a microwave oven and a coffee pot and a refrigerator door handle, these are the things people are touching. Let's make sure that we really are focusing on touch points. It talks about the disinfectant. We'll get into it a little bit more in a few minutes, but let's definitely use an EPA-approved product. EPA has a specific program addressing the coronavirus. I highly encourage you to check that list and make sure you're using a product that's approved by EPA. Let's make sure that we're following the label directions. Many disinfectants require a 10-minute dwell time. Read the label, make sure the cleaning process, the disinfection process is appropriately addressing the dwell time. In large buildings, whether it's a school or an office building or hospital, whatever it is, they're more than likely buying their product as a concentrate. And they're often using dispensing devices to dilute the concentrate into the ready-to-use product. And one of the things I want to encourage all of you to do who are using those dispensing devices is to make sure they are working properly. You can buy test strips, whether you're using quartz, whether you're using chlorine-based products, whether you're using ozone, whatever you're using, you can buy inexpensive test strips. They're literally like a penny or two to make sure your dispensing device is putting the output out appropriately. Please test them. Don't just take it for granted that they're working right. The guidance recommends providing disposable wipes. Those are great, especially if you can find them. As you know, they're in tight demand. Otherwise, we can provide people with a spray bottle or put one in an office with some paper towels so that they can do their own cleaning. And if they're going to use a spray bottle on electronic devices, make sure they're properly instructed to put the solution lightly on the cloth, on the paper towel, and then rub and clean the surface. And then finally, training is incredibly important. In some sectors, there is enormous amount of turnover among housekeepers, and there's going to be lots of upheaval among our workers. So let's make sure that all new workers are properly trained on cleaning and disinfection and the use of personal protective equipment. And let's also make sure our existing staff is reminded about these important requirements.
Steve, I'd like to interject. We're actually getting some great comments and questions here. So I do want to emphasize to people to keep sending those in. One comment we had here was, it sounds like from somebody on the front line, because they're faced with the fact of their clients asking them to clean more, to just do more cleaning, rather than focusing on these key areas that Steve has mentioned. And so it's important to remind your staff to have these conversations with your clients, that you are following the CDC recommendations and that you are focusing on these touch points to be more effective at combating this virus. So there's no need to wash the walls if nobody's touching them. So doing more is not necessarily better, but just being effective and persistent. And then also another question we have, Steve, is about communication tools that can help accurately and briefly communicate these policies for janitors and custodians who provide cleaning services within the facilities, just to make sure it's at the forefront of their mind as they're working through these facilities. So what are some of those communication tools you find are effective, Steve?
Well, obviously, most organizations have internal intranets where they can email information to people. Some companies, you may want to print out a little document and put a note on people's desks. There are, different meetings, different ways to communicate. Some organizations have TV monitors where they provide information to their employees to post information on those monitors. But I think that's a great comment. If we don't tell people what we're doing, it's easy for them to assume we're not doing anything. So, but before you just communicate, you have to figure out what it is you want to do. And we also have to make sure that we're not being arbitrary about this stuff, that we do have a good plan in place. Many of the contractors that I'm working with are already seeing worker shortages. Well, so if your staffing is going to be cut, we need to talk to our facility managers and say, as Katrina, you just pointed out, maybe we're not going to just scrub all the floors today. Instead of doing that every day or every 2 or 3 days, whatever it is, We're going to focus on the areas, the touch points, the break rooms, the elevator lobbies, the cafeterias, the obviously food preparation areas, and make sure that we're doing the things that will have the best return on investment in terms of protecting our occupant health. And I do also want to point out one thing, well, two things. One, thank you very much for the comments. Please keep submitting them. And the other thing is, as a reminder, we have other things that we have to be smart about from a cleaning perspective. For example, we need to make sure we're still cleaning our cafeterias, our food preparation areas. We have to make sure if there's a nurse's office, we can't just focus solely on the coronavirus. We have to make sure we're thinking holistically about this. Remember, we are the professionals. Let's make sure we're giving our wisdom, our knowledge, and experience to help make sure our customers are really taken well care of. So let's keep rocking and rolling. Forgive me. Into the cleaning and disinfection recommendations. It has these 4 areas: cleaning after someone has been confirmed or suspected or confirmed to have the coronavirus in the facility, how to clean and disinfect, personal protective equipment, and additional considerations. So again, each of these sections have a bunch of information in it, but just to show you some of the stuff, here's what it says on how to clean and disinfect. First, it talks about if the surfaces are dirty, to clean and then disinfect. They give recommendations then on the disinfectant. Use a dilute solution of bleach, alcohol solution, at least at 70% alcohol, and most common EPA registered household disinfectants, okay? And then it gives some explanations about some of the other things that you can use. And I do want to just suggest a couple of things about that. Number one, this is an incredible, unique experience that we're having. We have not really dealt with anything like this in 100 years. So this may be a time for this unique problem to consider a 2-step cleaning and disinfecting process. We know that many soils will deactivate the active ingredients in a disinfectant. So we may want to make sure to really be extremely thorough, to clean first and then disinfect, especially on highly soiled areas, especially, in my opinion, dealing with greases, fats, and oils, and food preparation areas. Those things, we can't just smear them around with a sponge or with a microfiber cloth or whatever it is. We may need to clean first and then to come back and disinfect. The CDC recommends or gives an option of using bleach. And again, I want to emphasize the word option. They don't tell people that they have to use bleach. It is an option. And there is no question that bleach is extraordinarily effective at killing bacteria and inactivating viruses. We know that. But so are other EPA registered disinfectants. The data is quite clear that people do not follow label directions. I'm sorry, they do not. For those of us who've been in the industry a long time, we understand the glug-glug method of diluting products. I am greatly concerned about this notion that we're going to get people to correctly add 1/3 of a cup of bleach per gallon of water or 4 teaspoons of bleach per quart of water. Please, especially if you are a professional cleaner, this is not about what to use in one's home. Professionally, I highly recommend that you use the other option and follow what EPA is recommending, where the products are appropriately approved by the EPA. Follow the label directions. I think it's a better process, and frankly, many of these are more preferable from a health and environmental perspective. And as I mentioned, EPA has a website. You can see EPA's, the URL for their guidance. They are updating this almost every day with more products that have been approved by EPA. And again, I highly would encourage you to use one of these products. If you are a service provider, if you're a facility manager, I highly encourage you to ask your supplier, your distributor, or the manufacturer if their product has been approved by EPA for this. Just for a peace of mind, and in some respects for your liability related issues, make sure that you're following and using the appropriate products. Again, to wrap up this section, please bookmark this page, and remember, we're not doctors, but we are professionals. If people ask you questions, the information is on these websites. Help them. But the information is there. We don't have to make it up. We can find it. We can help them. And we know how to do our job. So, okay. So let's keep going. The last part of the presentation before we take questions is just a few things that I just want to share with all of you, because beyond just the business portion of this, lots of people are really stressing over these issues. So, you know, if you've ever flown on a plane, the flight attendant stands up and they're going to give their safety announcement, and first thing they say when they talk about the oxygen mask is to put your own oxygen mask on first and then help others. So my first point is, please take care of yourself. You can't be helpful to others, your companies, your staff, the people you work with, if you are not taking care of yourself. For those of you who are being directed to work from home who have never done it before, just a few quick comments. I've been working from a home office for the past 19 years. My entire company is virtual. Learn how to work from home. It is not like working from the office. I encourage you to set a space aside. If you have kids in your family, if you have other things going on in your house, they probably have an established routine. They run around the kitchen, they're in and out of this place and that place. Don't just disrupt your whole family. Find a secluded location. You may have to work from your bedroom or other area, but find a place that you can set up as your own office. Make a schedule, get up at the same time, get dressed as you normally would, lead a normal life. Otherwise, it's too easy to get distracted, and that becomes its own unique problem. Also, do some of your own planning. You know, if you have time off, think about some of the things that you can do. Part of it is managing our own mental state and keeping a positive mental attitude and being enthusiastic. Those are all part of good health. Make sure you're doing some fun stuff. You can still get out. What the CDC and all the health experts are telling us is just, you know, to keep social distancing, right? So we don't want to go in crowds, but that doesn't mean we can't go outside. Enjoy the sun, mow the lawn, go for a walk, a bike ride, go hunting, do whatever you do that will bring some joy to yourself. Just don't do it in big crowds. And finally, one of the other things I want to tell you is, if you're going to have time on your hands, don't forget to continue to focus on your own professional career. You can call people, you can do lots of things, and consider taking an online class. There's a lot of professional classes that are available, and consider working on it. Use the time constructively. When you're dealing with your family, obviously, think about how you can support them, and as well as if there's anything we can do to care for our other friends and neighbors. For food, don't hoard. Check out online grocery deliveries. I have to admit, I've been doing that. It's insane. It is. It's insane. This is the tidal wave. It will calm down in another week or two. At least that's my prediction. But check out the different services. Do you even have the availability of delivery services even for your groceries? Because if they can deliver in a day or 2 or 3 days, then you only need to stock up for a day or 2 or 3 days. You don't need a month's worth of supplies. For those of you who live in the country who may not have these access to these kind of online services, check in your neighborhood. And please, I spent most of my life living in Indiana. We're very good at working with our neighbors and supporting our neighbors. In some respects, I think country, rural communities are much more prepared for dealing with these things than those who live in large metropolitan areas. Check out what's available and make sure you're taking care of your neighbors. As far as the health stuff, if you're feeling sick or someone in your family is feeling sick in your company, don't just go to the emergency room. Call a doctor. There's online nursing services. Call first. Let's face it, there's lots of colds and flus and stuff out there. You may in fact have a cold, but that's not the coronavirus. And I'm not a doctor, so please call one. Don't just show up at the emergency room. And finally, think about your finances a little bit. Interest rates have come down. You've seen what the president has done. Again, I would wait a few weeks. The banks, all these people are giving out lots of loans. They're being inundated. So wait a little bit, a week or two, or before you start putting in your applications. There'll be plenty of money, but consider the opportunity to refinance your home. Right? You can save a lot of money to do this. But my real reason of saying all of these things is make a plan. This is an opportunity. The time that we're going to be at home or that we're going to go through this crisis is what it is. Let's deal with it professionally and competently. Let's make a plan and be as effective as possible as we work our way through it. Last couple of things I just want to share about your organizations, because I'm assuming that the majority of you are senior people in your organizations. So a few different things. From a business perspective, have a plan. I mean, are you going to need, because of sourcing related issues and staffing issues and what have you, think through how you're going to prioritize your accounts. Are you just going to cut everyone 25%? Or do you have some organizations, hospitals and others, that really are going to take precedence over others? Think about it. Think about the size of the accounts, what happens, who's important to you. There's no right or wrong answer to any of this. What is important is that if you're a business leader, that you think it through. Don't let your staff just be arbitrary about it, giving important supplies to their friends when it really is or should be directed to more strategic clients. So as a leader, think these things through. As a business leader, talk to your accountant. This information is changing literally on a daily basis. I am expecting the Small Business Administration to make loans available and things like that. Make sure that you're talking to the experts, to your accountants, to find out what's going on so that you can get in line and be prepared to take care of some of these things. Make sure you're talking to your suppliers. Stay in contact with them. And you see, as Katrina mentioned from one of our earlier commenters, figure out what your communication plans are, both to your employees as well as to your customers, about what you're trying to do, how you're doing it, the additional cleaning, the additional preparations. And finally, help your team. You know, the information I'm talking about, personal stuff, family stuff, I know this is maybe inappropriate in some organizations, but where you can, Help people. Just telling people how to plan is often not enough for many people. Help them map out a little bit of plan. You know, here are the 4 major bullet points that you need to think about. Here's ways where they can find information, but help them a little bit. Help them plan. And
Steve, we actually have an
finally,
additional comment there. Sorry to
okay.
interrupt. Again, please send those questions in if you have them. But one thing somebody also want to stress is the importance of keeping those who have to come to work, your drivers, your warehouse workers, those who cannot work out of a home office, the importance of keeping them well and protecting them. And for you as an employer, you have the right to send workers home who appear sick. OSHA, as well as other reputable lawyer rights sites, confirm that you do have the authority, as long as it's not applied arbitrarily or with discrimination, to send somebody home who is obviously sick. And that equally poses direct problems for your staff who is not sick. So please consider that and stress to your workers who are showing up that if they are not feeling well, you got them covered, and it's in everybody's best interest to stay home so your business can keep running in these very crucial times, to keep running your trucks.
And the same thing is true for, you know, our cleaners. So, you know, let's just be smart about this. Again, the CDC guidance that I went through gave specific recommendations on those issues. So I hope you bookmark that page. You can find it there under the section on businesses. So yes, thank you for the comment. And again, from a business perspective, don't be arbitrary. Spend a few minutes writing this stuff out. Let your people know. And also by doing that, you'll be more prepared and more comfortable with what you're doing, and probably better at responding in that moment. So spend a little bit of time, develop your policies on what happens when people are sick. On, you know, in my company, we're not traveling, those kind of related issues. One of the other things that I want to encourage all of you to do, if your companies or if you personally are not familiar with the virtual conferencing tools, this is a great time to really learn how to use them. Let's face it, they're coming. They're here now. Learn how to use them. Learn how to be effective at using these kind of tools. And the last couple of things is you got to plan for absences. More people are going to be out. So think about your business, how you're going to deal with that, and if you're going to cut back, where you're going to cut, how to do it as painlessly as possible. But think it through. You don't have to wait until it actually happens. Whether you're managing a cleaning staff, if there's 10 people in your building and only 5 are going to show up, have thought through what are the priority areas in that building that needs to get cleaned. Think it through. Don't wait until the last minute. And I'm sure most of you have already done that, but for the others, please use this time to think about that. For you distributors, think about if only half your delivery drivers show up, how you're going to manage that. So spend a little bit of time of thinking about it. There are no perfect answers, but preparation will help you be as successful as possible. And finally, I'm encouraging you every day, literally every day, spend 15 minutes on the CDC website. I don't know how you get your information, whether you're a news watcher, whether you watch ABC, NBC, CBS, Fox News, MSNBC, CNN, something else. The experts are CDC. Spend 15 minutes a day on their website, seeing what the experts, the medical experts, really have to say. And I believe that that will be the most helpful to you. And to conclude this part, we'll open up for questions. Again, this will pass. We'll get through this. We are capable. We are smart. We have the products. We know how to clean and disinfect. We know how to train our people. We can do this. And at the end of the day, let's make sure we demonstrate who we really are, that we're competent, we are committed, and we really do care. And at the end of this, hopefully we can change how the world views cleaning. We want them to make, we want the world, we want our customers, we want the government, we want the policymakers, we want the medical experts to make sure they understand that cleaning will forever be recognized as an important, effective, and low-cost health intervention strategy. So with that, let me open it up to any other questions that you might have for the remaining time that we have for the webinar today.
Great. Thank you so much, Steve. It's really nice actually getting some clear, direct guidance because it really can be information overload these days. So I do want to stress everybody, remember that chat icon in the upper right-hand corner. Please click and send me your questions. We've been having quite a few come through. So I'm going to get started concerning disinfectants. So the question is, sometimes people have a false sense of security that the products they are purchasing covers all 3 different types of organisms that need to be killed from a disinfectant. Can you please clarify, Steve, those 3 different types of organisms and how they can ensure that they're buying the right products?
Okay, so I pulled up EPA's emerging viral pathogen guidance for antimicrobial pesticides. And what I want to emphasize is right now, this is what I'm recommending to people specific to dealing with this virus. There's a lot of things that normally go into the decision about buying a disinfectant, but first and foremost, I'm really encouraging people to follow this guidance. And it's not because this is my personal opinion, it's because this is the recommendation of CDC, and directing others, giving other guidance, and this would be irresponsible. So trust me, I get all the other stuff that might go into the consideration, but make sure you're paying attention to this. If nothing else, from a liability perspective, at least this is the advice I'm giving to my clients who are building owners, property managers, and facility managers. And every day EPA is adding more products to this list, but make sure your disinfectant meets these requirements.
Thank you, Steve. So another question we have is it too late to start reaching out to our Jansan customers to help them with their COVID cleaning practices?
Sure. I had to think about that a second, because we run businesses, and I'm always very careful about using crises like this to make a buck. Okay, so I don't want to be, just focus on the money. But the reality is, a lot of companies are going to need help. They need help. A lot of companies have made, and I'm talking about the customers for our industry, and a lot of companies have not taken cleaning that seriously. A lot of companies have seen our only role is to pull the trash and, to clean the bathroom, and that's the extent of it. We know that. This is a time that if we can help them do better, if your service can do better, you've trained your people, you're going to do it right, you have staffing available to do it, by all means, I would encourage you to try to help others. And if you can do a great job for them, I hope your company profits handsomely. That's how capitalism and the marketplace is supposed to work. Please take care of your customers, please treat them fairly, and by all means, follow all the guidance and do it right.
Thank you. So another question we have is, since this environment is changing daily, do you expect to provide a follow-up webinar in the future concerning the COVID-19 and new developments?
If people would like me to continue to update parts of this and to provide periodic updates, whether it's weekly, bi-weekly, or what have you, if there are particular topics you'd like for me to dive into and provide more information, if you would like for me to talk to some of my friends who are medical experts and to see if we can get information specifically for the cleaning industry, send some comments to Katrina or to me, and yes, I would be more than happy to do this.
Excellent. So there's one question here for me, which is this presentation being recorded and made available after our discussion? Yes, it is being recorded and it will be posted after this discussion. We will be sending the link out via email to all the people who have signed in, as well as a PowerPoint, as well as a PDF version of this PowerPoint.
And please, you do recognize that this is a free workshop. You know, we're not doing this to make a buck. You know, we're doing this, we genuinely care, and as I figured out a long time ago, things like this is called the price of leadership. And I'm only saying that because if it's helpful, you want to share this presentation, Katrina will send you the link, share it with others, but let's work together, because together we really can succeed. Together we can do it in a way that will minimize the disruption to life, and frankly, it will minimize the number of people who are going to die from the coronavirus. So yes, share it. We can do more workshops. One of the fun things, and fun maybe is a terrible word, is I'm putting together a video, a little training program like this for nurses to be able to share to help people clean their homes. So if you have any thoughts about that, ideas that you think people should be doing in their home that are simple and effective and helpful, I'm trying to put that together and by next week. So let's work together, let's be helpful, and know that we really can and are making a difference.
So Steve, we have a question coming in here about what probably something we have all seen going down the grocery aisles in our supermarkets around shortages of particular products, mainly toilet paper and hand sanitizers, as well as disinfectants. So the person asked, what can we do to help prioritize our clientele list who receives these materials, as well as manage disgruntled customers who are not getting the products they are requested?
You know, some things like toilet paper and paper towels, people are going to use as much toilet paper and paper towels as they normally do, right? The amount of toilet paper doesn't increase because people have a virus or whatever. So people are just going crazy and they're stocking up and buying months and months and months worth of toilet paper. And the only reason I'm mentioning this is once those people go through and they've stocked up and the manufacturers have replenished stuff, I predict that in another week or two, we'll have plenty of toilet paper back in the grocery stores. So between now and then, most of the grocery stores that I've been in contact with are starting to limit how much people can take. And, you know, we just have to bite our tongues and be careful when some irate, desperate person is yelling and screaming at us. and just plead for their patience. We understand the problem. Our industry, our manufacturers are working really hard at it. But I really don't think there's going to be a long-term disruption of the availability of toilet paper and paper towels. As to hand sanitizers, the immediate thing is to tell people just to wash their hands. And if you'll allow me, not only would I like to tell them to wash their hands, personally, I'd like to encourage them to wash their faces as well. But we can talk to them, soap and water works great. It really does. Right? Let's get the virus off of our hands. We don't have to kill it. As long as it's off of our hands and we wash it down the drain, we're going to be just fine. So I also believe that the hand sanitizer stuff will be replenished soon. We'll get through this. But in the meantime, just encourage people to wash their hands and at least try to show some compassion for them. A lot of people really are just stressing out. Tell them that you understand. Try not to get too mad at them. But at some point, if they're just going crazy, you're just going to have to shut them off. So it's unfortunate. Some people are just like that. And unfortunately, we can't really fix the problem immediately. So please be patient. Don't take it personally. And we really will get through all of this.
Thank you. Well, that concludes all of our questions. If you don't mind going to the next slide, Steve. I do want to thank you all for joining us today, and please do not hesitate to contact me or Steve directly if you have any questions. As I mentioned, we will be following up with the link to the recording and these slides, and would be more than happy to help you navigate through this unprecedented time that we find ourselves in. So thank you all for joining us. It truly was a pleasure speaking with you, and I will be in touch if we end up planning another session. Thank you. Have a great rest of your day. Be safe. Don't forget to wash your hands. Have a great day. Bye-bye.